Looking for a primary care doctor can be very easy at Evernorth Care Group. Why? Because they have 20 locations all across the valley to make it really simple. But today, I am with Dr. John Sassano. I'm at the Paradise Valley location where he treats patients here at this location, right?
Yeah, I do. Yes.
Oh my gosh, well, it's so good to meet you, and I'm excited.
Nice to meet you too.
We're going to talk today about diabetes, and this is, I don't know if it's me, but I feel like that's all I hear about anymore. Is it as an epidemic as I feel like it is?
It's very common. 1 in 10 Americans have diabetes.
Really?
Yes.
That's a lot.
It is a lot. It's the leading cause of blindness in the United States. And 1 in 10 people having diabetes, twice as likely to develop heart disease or strokes.
Oh my gosh, that's actually very scary.
It is scary. It's a very important problem.
Why is it that so many Americans are being diagnosed with diabetes today? Is it lifestyle related?
It can run in families, but it is lifestyle related. Obesity, not exercising, poor diet.
Yeah, well, we talk about that a lot, right?
That's right.
Now, specifically, there are 2 types of diabetes, but you treat type 2 diabetes, is that right?
Type 2 diabetes, correct.
Okay, so first of all, how does somebody know? I mean, is there any sign or symptom that we should look for if we think we might have diabetes?
There are some common symptoms. Urinating very frequently, thirsty all the time, dry mouth, and sometimes feel like you can't get enough to eat. You're always hungry. Those could be signs. Changing in your vision, like blurred vision, all of a sudden can be a sign of diabetes as well.
So when somebody comes in to see you for the first time and they maybe suspect, I've got some issues here, what are some of the things that you need to do in order to find out if we are diabetic?
Well, the most important thing would be a blood test. We do a blood test and it would show elevated blood sugar, and then from there we would go. Depending on how elevated it would be, that would decide how aggressive we would need to be as a physician.
Okay. But here at Evernorth, you guys do things a little bit differently. It's more of a team approach, I feel like. So tell me about how that works. Should I be diagnosed as a diabetic?
We do have a department called the FIT team, which is our patient health improvement team. And we have clinical pharmacists, diabetic educators, and community resource to help the patients along the way, and also to help me as a physician to treat my patients.
Oh, wow. I really like that, because education is so important, right?
It is important, especially with diabetes.
Yes, because now we have to make a change in our lifestyle, right?
Correct.
And we hear a lot about, a lot of the medications that are out there, and weight loss, and what is your take on that? I mean, obviously they're to benefit diabetic patients primarily, right? Are they working? Are they helpful?
Oh yes, they're very helpful. They do help to control our blood sugar, bring our blood sugars down to a safe level, to help prevent those things I mentioned before, the heart disease, the eye problems.
And that's really what it's all about at this point, right? When we're diagnosed is prevention, being proactive.
To be proactive, exactly.
Yeah, which is why that FIT team really is so important.
It's very important.
Yeah, because we have to relearn everything, right? And we need to maybe lose some weight.
Yeah, lose some weight. What
change
foods,
our diet.
change our diets, for sure.
Is there anything that anybody can do to prevent diabetes?
Healthy lifestyle. Keep your weight down.
Sounds simple, right?
Eat healthy, yeah, exercise, that helps.
All right, anybody out there who thinks that, diabetes is prevalent in their family, should they be concerned?
Yes, they should. They should see their family doc. Okay. They should get some blood work done. Okay. That would be the start. And then if they happen to have increased blood sugar problems, then there's ways that we can take care of that, either with medication, diet, exercise, the FIT team.
Right. It's a whole team approach here at Evernorth. Dr. Sassano, thank you. Really good information today.
Thank you.
And here's more. Evernorth Care Group. You can make an appointment at any of their locations by calling 800-233-3264 or visit the website to learn more and find a location near you. evernorthcaregroup.com.